Hello, good day, and welcome back to the continuation of our discussion for topic 3, medical assistance to provide during emergencies. And for today, we will be talking about basic life support or BLS. Basic life support is a level of medical care which is used to victims of life-threatening illnesses or injuries until they can be given full medical care at a hospital, and it can be provided by trained medical personnel, including emergency medical technicians, paramedics, and by qualified bystanders. And one of the things that we can do um, as part of the basic life support is by conducting or performing the CPR. And this early resuscitation and prompt defibrillation within 1 to 2 minutes can result to about 60% survival rate of the victim. And in basic life support, the most important to remember are to check or to remember your ABCs. A for the airway, the breathing, and the circulation of the victim or the patient. So when conducting the basic life support, these are the chain of steps that we have to do. First is to approach safely the person or the site itself, because there might be hazards or you might actually cause more pain or injury to the person. And the next is to check for response. You can do this by simply gently shaking the shoulders of the person or gently tapping the person on his or her shoulders and trying to ask him if he or she is all right. If he or she responds, you can leave him as you found him, but make sure that you are going to check regularly his status. And then, of course, always shout for help. And then after that, if there are still no help coming or there are no medical personnel coming, you can check, or if the person is unresponsive, make sure to check the airway. You can do this by tilting the head and lifting the chin. And then, however, if you think that he or she is not breathing, maybe you can check if there is something or there are solid materials in preventing him from breathing. You can do this by tilting the head, lifting the chin, and thrusting the jaw, and trying to see or sweep the throat area, or trying to use maybe a flashlight to see if there are dislodged materials preventing the person to breathe. After that, of course, check for breathing. Look and listen and feel for normal breathing. And do not confuse normal breathing with what they call agonal breathing, because agonal breathing is something that occurs shortly after the heart stops and up to about 40% of cardiac arrest. And agonal breathing is something that can be described as barely, very heavy, noisy, and gasping for breathing. And sometimes you have to recognize it as a sign of cardiac arrest. And of course, after all this, make sure that you are going to call for call for emergency or call 911 or any emergency number. Now, moving on, if the victim or person is unresponsive, not breathing, and rescuers are still on the way, you can perform cardiopulmonary resuscitation or CPR. Firstly, start with chest compressions. For adult or for persons aged 12 years old and above, you can place the heel of one of your hand at the center of the chest and then place the other hand on top. You can interlock your fingers or you may not. But if the victim or the person is a baby or at least 11 years old and younger, you you should use your two fingers to avoid putting too much pressure. However, when doing chest compression, this must be fast and hard, and then press down 2 inches or 5 to 6 centimeters into the chest. Each time, let the chest rise completely and then count 30 compressions quickly. The counting should be done like this: 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, and after 30 counts, you have to stop. And of course, if you get tired, make sure that you are going to ask another person to help you, and it should be done every after 2 minutes. After chest compression, you can also perform rescue breaths, and there are rescue breaths, and there are three ways you can do rescue breaths. First is mouth to mouth. You can The first thing you have to do is to pinch the nose, and then open the mouth, and then take a normal breath, and then place your lips over the mouth, and then blow until the chest rises, and then take about 1 second, stop, and then um blow another breath again, and then repeat this. Now the second um rescue breath that you can do is through the nose. And this is something that you can perform only if you cannot open the mouth. Maybe it is fracture or something is sealed in the mouth. In doing this, make sure that you're going to close the mouth properly so that the air will not go out there. And then put your mouth around the nose, and then that is where you're going to blow the air. And lastly, when the victim is a child or baby, you can blow both the nose and the mouth at the same time if you can seal them both. So when can we stop, or when should you stop doing the CPR? Of course, if the victim revives, or maybe the medical team has already arrived, or maybe you are too exhausted to continue, but make sure that someone is there to change you. And maybe, of course, if the place or the site is very hazardous, you must remember to try to clean up the place or make it as safe as possible, or you can try to move the patient only if you know that you are not going to cause further injuries. And lastly, if it was directed by the physician, maybe because it's already been too late and the life has already been lost. So other thing that we have to also consider is that what could be the possible reasons CPR may fail. And there could be delay in starting the CPR, or the first aid was not given or administered immediately, or there could also be improper procedures, such as you forgot to pinch the nose, because if you did not pinch the nose, the air that you're going to blow would just come out from the nose. And maybe there is no advanced cardiovascular life support follow-up, or there is delay in the coming of the rescuers. And lastly, maybe because of terminal disease, or it was caused by a massive heart attack. And as helpful as it may be, CPR can also result to injuries, especially when done improperly. This could include fractures to the ribs, or maybe there can be some lacerations to the tip of the sternum, such as the liver, lungs, or the spleen. And lastly, we should also be aware of the complications that can happen during CPR, such as the victim may suddenly vomit, or there can be aspirations or coughing coming from the victim or the first aider. If such events happen, place the victim on the left side, wipe the vomit from the mouth with fingers, wrap in a cloth, and resume CPR. Okay, so that ends our discussion for basic life support. Thank you and good day.